Hey, welcome to Class Apps. My name's Daniel White and I'm your host for the segment. This week we'll be taking a look at the Paramedics program at Conestoga College. We'll be asking them what kind of technology they use, hopefully get some demonstrations, and I will get to try some stuff myself. We're sitting here with Robin Young, and he is the program coordinator for the paramedic course at Conestoga College. What kind of technology are they using and learning how to use?
Well, they learn we use a lot of different types of technologies, basically the hands coming from one level, right up to defibrillators and cardiac monitors and certainly IV equipment. The defibrillators act as heart monitors, so you can look at the electrical activity within the heart to help you to support what you suspect is happening with the patients. It is up to date. The profession is changing all the time, so you do see new types of equipment coming out. So now there is other respiratory equipment that's coming out that has been in the hospitals for a long time, but is now just allowed onto the ambulances, and in the primary care ambulances specifically. So you see new technology coming out all the time. Initially it's in the services, and then once it's an expectation in the education, then it's downloaded to the colleges to teach that information and teach those techniques to the students.
We are here with Michelle, and she is a student of the paramedic program. What year are you in, Michelle?
I'm in first year.
You're in first year? Yeah. So, and she is going to be showing me, what are you going to be demonstrating to me on this dummy here?
So today I'm going to demonstrate when a patient has oxygen on, and we need to use what we call a big valve mask. And this allows us to help ventilate them because they're unable to get oxygen in on their own. Okay. So now what we need to do is we need to help get it in for them. So what we would need to do is we need to take this apart, okay?
Okay.
Put that aside and we need to attach this to the bag. What we want to do is we want to make sure we get an okay seal, okay?
Okay.
So come up on the nose here, under the mouth, and you need to make sure. So
okay.
Put your hand, you need to make a C.
Okay, so C here?
Yep. Fingers under the chin, and you need to make sure the airway is open in order for the air to get in, okay?
Okay.
So you need to pull your fingers up a bit to keep the chin up like this.
Okay.
Okay?
So keep the chin up?
Yep. Okay, and then what you need to do is give one breath every 5 seconds.
Okay, so then this is giving oxygen to the patient and helping them breathe so that you can get them to the hospital in time for them to get proper treatment.
Absolutely.
We're here with another first-year student. Her name is Fiona, and what are we listening to right now?
So this is our cardiac monitor. So what it does, this is called a 2-lead. So these hook up to pads. One goes up here, one at the ribs, and there's signals that go between the pads and it basically communicates to each other. So this is the rhythm you see here. There's different waves. So that's a healthy heart rhythm right there. It's called a normal sinus rhythm. Okay. And this also acts as a defibrillator. So if you were to press the analyze button, it would tell you whether or not you need to shock the heart, and that gets it back to its normal heart rhythm again.
Excellent. Okay. So, because this is the main thing that you see in movies and film and stuff when you're in a hospital.
Yep.
But so it's there's truth to the movies when this.
Slightly.
Is this present in all situations or?
Yes, it's always a good idea to hook up the patient to the monitor, and oftentimes they can be pulseless but still have electrical activity, and that's what that line shows.
Okay, excellent. Thank you very much, Fiona. So that's all today for Class Apps. We hope to see you again next week when we investigate the culinary arts. Be gentle, please. Oh.
Locked? Mm-hmm. Right.
I'm going to the hospital.